Okay, it's 1 o'clock. I see some folks filing in as attendees. Hopefully everybody can hear me okay. My name is Everett Logan. I'm the Executive Director at Mountain Valley Treatment Center. This is the first of a series of webinars we'll be doing this fall to talk about some innovations in treatment that we've been doing that hopefully will be interesting for folks to learn about and helpful for others in the industry to get some new perspectives on residential treatment and treatment of anxiety and related disorders. What I'm going to do is not talk very much and hand it over to our presenters. I will be the moderator today, so I'll take questions. We will talk for about a half hour and then have about a half hour of time that folks can stick around if they'd like to ask any questions. And so what I'll ask you to do is if you could share your questions in the chat section, or in the webinar, it looks like it's called the Q&A section. And then I'll pass those questions along to Zack and Tim at the end, and we can go through, have some discussion as well. So I'd like to introduce our two panelists today. We have Dr. Tim DiGiacomo, who is the clinical director at Mountain Valley, and we have Zack Schafer, who is an occupational therapist and is the Milieu director at Mountain Valley. So without further ado, I will hand it over to Zack and Tim. Take it away, guys.
Hello, thank you everyone for being here today. We really appreciate you taking some time out of your day to join us, especially for us to be able to talk about some of this important and work that we're passionate about. So it's really nice for us to have a chance to be able to share some of that with you, and hopefully to have more of a conversation ongoing with you all about the work that we do, and to get to know a little bit more about what you all are doing as well. So for those of you who know about Mountain Valley, the cornerstone of the work here is in cognitive behavioral therapy. And so we're teaching our residents more about connections between thoughts, feelings, and behaviors, and how that relates to anxiety, working through anxiety and improving their overall lives. The B in cognitive behavioral therapy, the CBT, that's really more focused on exposure therapy. So what we're doing is ERP, exposure with response prevention, or exposure with ritual prevention. And that has been sort of the mainstay, the gold standard of treatment for anxiety and OCD. It's evidence-based, and it's, when delivered well and competently, you're going to see some real improvements in reduction in symptoms, and improvements in overall functioning. And that's a big thing that Zack and I and Everett, and the team here, that we spend a lot of time talking about and working on with our residents. Not just the symptom reduction piece, but the overall improvement in functioning. And our residents, our clients, being able to do the things that are actually important to them, that they've been limited in doing due to their anxiety, OCD, and other related disorders. And what we've found more over the past year or so is more of how we can sort of supercharge some of the exposure work, really enhance the delivery of it, so that you're not doing just exposure work in the therapy office. It's not a 1 hour and then the 23 other hours of the day you're not doing anything. So really that 1 hour of individual therapy, say, you really want to maximize that everywhere else. You want the work to be generalizable. And that's really where Zack and his team in the residential department really come in and kind of revolutionize the work that we're doing, and create a real good synergistic partnership with the clinicians. Maybe I'll let you talk a little bit about some of the OT and some of the milieu therapy that we're doing that's been enhancing the exposure work.
Yeah. So a lot of times in our industry, the words milieu therapy are kind of thrown around, and it's not as clearly defined. And it is a little bit more of a philosophical concept in its origin. And what we're trying to do here at Mountain Valley is make it much more practical and make it much more founded in evidence. So a milieu is essentially a structured environment that has a set physical environment, social dynamics and sort of parameters, some cultural norms, and a set of routine rituals and activities that happen throughout the day. So my job as the milieu director is to sort of make sure that our milieu is set up to be socially supportive and inclusive for the peers, but also to be informed by the principles of CBT and ERP. So when the natural exposure opportunities come up throughout the day for the kids, that our staff are well equipped to help coach them through the process. The other really important part of the milieu work too is that it is meaningful for them to participate in. Like that whole willingness piece, and how do you get a kid to want to do exposure work and face some of their biggest challenges is if they're motivated to engage in the activities that they can engage in because of their anxiety and their OCD. So not only are we trying to provide an environment that can sort of help support the kids in engaging in what they want to engage in, we also have to create activities that they want to engage in. We have to try to tap into their interests, tap into what they enjoy, what is typical of an adolescent in their developmental stage. What kinds of activities do we know are really good for their health and well-being? What kinds of activities do they want to be engaging in, need to be engaging in? How do we build that into a structured routine? How do we see the challenges with OCD show up in that routine? And then how do we use this as sort of a playground sort of for them to learn, develop, practice the psychotherapeutic skills and the ERP principles so that they can transfer it to their natural environment once they leave Mountain Valley. I'm in a unique position being an occupational therapist, and I think further along in our webinar series, I'm going to get to dive a little bit deeper into OT and its role in mental health. But essentially, we take a very broad approach to functioning, and we really look at all the different areas that human beings need and want to engage in their lives and sort of what the barriers are to getting there. So we have what's called the rehabilitative mindset, but also an habilitative mindset. And the rehabilitative mindset is much more about helping the kids restore their functioning in areas that they may have lost. So a kid with OCD is really impacting their hygiene and they've lost their ability to take care of themselves. But it's also about habituation. And that's about developing things that they may not have had before. So a lot of our kids may not have had a lot of engagement with physical activity or a lot of socialization, social skills and things like that. So it's a process of both rehabilitating what they've lost, but also building what they may have never had so they can then take that once they leave. And I think it's become a pretty cool approach that we've had.
Yeah, you know, as you're talking, you're bringing up some other important points, I think, about exposure opportunities. All right, so oftentimes I think people are thinking of exposure therapy, you know, in a very traditional way, which is gradual collaborative exposure, where you're prescribing, you know, as a clinician, you're maybe prescribing or working with your client to design and build exposures. But really, where we want to go in addition to that is to get our residents, our clients, to a place where they're taking on more of an exposure lifestyle, right? And so, and when they get to this, you know, when they're in the milieu and just an opportunity arises and it ties in with something that's meaningful and important for them, and they see that as an opportunity to say, you know, I'm really anxious right now, or you know, my obsessive, intrusive, unwanted thoughts are telling me I shouldn't do this, but there's another part of me that really wants to do this, right? I want to go be with my friends. I want to go, you know, do this exciting activity. It's then there's that willingness to actually push through the anxiety, push through the OCD, and say, I'm going to be open to some potential discomfort, right? And also to some potential big time reward for this thing that seems meaningful to me and important. And so, you know, that can have this, you know, it can help build momentum. Then you brought up the idea of motivation as well, motivation and willingness. You know, what we see is that as our residents are engaging more, there is that snowball effect in a very positive way. And so they're able to start to see, well, I was able to do this hard thing for something meaningful. And I'm going to try to do another hard thing, also for something meaningful. I was working with Zack in a wellness module, and that reminded me that I used to really like going to the gym, or working with our creative expression module, and that reminded me really like to paint, or more the habilitative piece, right? I learned that I like to paint, and I can find a way to do that with anxiety, with worries about, is it going to be good enough, with social judgment. I'm willing to take that risk. In fact, I'm going to invite that risk, right? And then it's the staff and everyone's job here, it's our team that's going to really try to rally around and continue to encourage that.
Yeah, and I think that that's one thing that Mountain Valley has done exceptionally well, is to create a culture of embracing fear. I really feel like here it is just a lifestyle. And there's something about the community component of watching other peers face their fears, or coming into a program and seeing a kid that's closer towards the end of their treatment and seeing how much their hard work has paid off, and all those opportunities that maybe you could speak to this more, that you miss out on in the outpatient world, where you're doing just that one-on-one client work. And there's not a community of people all along the same journey, trying to accomplish the same goals. It certainly has a different feel to it.
Yeah, that's the whole beauty of the Milieu component to it. And I think we have some folks on today that are joining us who are doing outpatient work, and oftentimes when I've traveled and given talks before, and I've been an outpatient therapist before, it's finding a way to think a bit outside the box of how do we create a Milieu. So Zack and I we have the opportunity to do it here in a residential program. It's a pretty natural place. But I think we could probably expand that concept of Milieu to an outpatient approach, or how do you work within a school, to find other kids. I mean, I've worked at schools and run anxiety groups there, right? So then that's the Milieu. And then how do you take it and how do they work together? Maybe two of them are in class together, right? How do they keep building on it? So I think it doesn't have to just, the idea of Milieu and the work that we're trying to do here, it doesn't have to just be isolated to residential. I think it just takes a bit more being thoughtful and mindful and creative about how you can sort of harness that other natural Milieu that's around us as well.
Yeah, no, I think that's a really good point. And I think that a lot of the Milieu environment too that we're also working on is the home Milieu.
Yeah,
the home is its own Milieu, and a lot of the work we're doing here too with parents and supporting parents and creating that exposure lifestyle, teaching parents how to embrace their fears and embrace their anxieties, because when it becomes more of a cultural sort of way of enacting with your life and approaching fear and anxiety, it's going to help that child's willingness, and it's going to just help it becomes more habitual in the way that they approach their challenges. I know Mountain Valley has been doing Milieu therapy long before I came, and Milieu therapy has been happening a lot before, but I think the OT lens adds a different perspective, because we can look at the therapeutic components of the activities in and of themselves beyond just what it's doing from an exposure standpoint. Like a lot of our kids who come may have some challenges with sensory processing disorder, or have certain sensory processing needs that then require certain activities for them to engage in throughout the day that meet those neurological needs that they have. So my job is to set up an environment where exposures can be friendly, but also just the environment of care is promoting their health and well-being overall from what they need from an activity engagement standpoint.
Yeah, I think it's good you brought up that idea too, the sensory work. I think that's certainly been a significant positive change that I've seen since we've incorporated more of the OT work into the Milieu, and then overlapping that with the CBT and the ERP. I think it's really actually helped to really round things out for a lot of our residents, and sometimes some sensory challenges are not always amenable to just straight traditional ERP work, right? So we need to find other ways of helping our residents and our families to understand those sensory challenges, and then still how to be functional so that they can be doing the things that are important, like being able to make it to school, being able to be, and we're talking about being in the milieu as a very positive thing. But if you have sensory challenges, if you're hypersensitive to auditory stimuli, well, then being around 10 or 12 or 20 other residents talking and joking, that might feel pretty uncomfortable, right? And so it's not just them telling, well, find a way to sit through it, right? But it's actually working from an OT lens as well. It's that, here's a different approach that you can take, and here's why it's going to work.
Yeah, how do we increase your tolerance for distress, but also give you strategies for getting that distress within a window that you can manage.
Right.
And I think approaching the problem from both ends helps the client and the kids that we work with feel very heard and validated in their challenge, while also being challenged to approach the barriers in a little bit of a different way.
And I think what we're seeing is, as our residents are able to take advantage of that opportunity, right? Then again, it builds on itself. So I've learned some skills to really deal with my distress. I've gotten habituated to it and desensitized to it from more of an ERP approach. I've learned these OT skills, and it's just fun now to be with friends, right? Like, I've realized I can be in the loud room with other people doing what they're all doing, rather than having to stand outside, stand away from them. And so then that means they're more living their life according to their values and what's important to them.
And I think another area too, where some of the milieu stuff we really do a good job is, it is structured, and we do have a consistent routine, and we do have certain principles and activities that we think are beneficial for the kids to be engaging in, but we're also adaptable. And a lot of times when our kids do have a transition plan in place, we then try to adapt what the milieu schedule is to sort of reflect a little bit more what they're going through. I think of this particularly with our young adult population and a lot of our college kids. And our milieu, again, tends to be supervised, or it is supervised 100% of the time. But for certain kids, we have a concept called autonomy. And that's where we have increased decision-making and choice around which activities they engage in. And for kids who are in college and learning how to manage their own schedules and go through the decision-making, and do I want to go to this activity, or do I need to tend to my own needs? And sort of going through that whole thinking process can be very intertwined with the anxiety or OCD around school and performance at school. And it can be a great opportunity for us to sort of adapt our scheduling, or adapt the way that they engage with our programming to sort of match where they're going once they leave.
Yeah, I think that's a good point. The idea of autonomy too, and speaking to some of the flexibility to meet the needs of our residents, and they're then able to, I think that speaks again to that concept of them being open to additional challenges, right, in line with what is important for them. Which direction do you want to go in life, and how do we help set you up for success with that?
Did you have any particular cases that come to mind when we think about how we've integrated things really well?
Yeah, I mean, I think there's several that come to mind, especially where, think of someone who comes in and they sort of have maybe it's like a very hypervigilance, or a deer in the headlights kind of look about them, right? And worked actually with a lot of residents like that. You imagine coming into a whole new setting, right? You're already predisposed to and struggling with anxiety and maybe OCD and other challenges, right? And maybe for a long time you spent your time in your room or on your devices, or kind of just staying away from others. So primarily just isolated, right? So then you're thrown into a milieu with other residents, with structure, with, you're dealing with maybe changing your sleep schedule back to a more healthy and adaptive sleep schedule. So there's just a sensory overload there. There's a, just this feeling of overwhelm. And I think, when trying to then orient someone and get willingness to, well, hey, you're here, and the therapy that we're going to be doing is actually, we're not going to be avoiding anymore, right? We're going to, we're going to talk about all the things that make you anxious and scared, and then we're going to find a way to approach those things, right? And so helping someone to be able to buy into that, really understand it, and have the wherewithal to buy into it and understand it when they've got this sensory overload, right? So I think that's really, that's something I've seen, I think has been fantastic, especially over the past year, where, especially OT can come in and do some individual work with someone to help with that sensory overload, help them get used to the fact that they're no longer isolated, that they get used to the noise, the sounds, the touch, the timing, everything. But then also that the milieu then is informed by that, so that it's not, again, just the individual work that we're doing, but rather it carries on through everywhere else here.
Yeah, a lot of times when kids first come in, they need the program to be graded down step. It's a big jump to go from that place that they were prior to needing residential treatment to coming here. And being able to grade it down so some level of participation is achievable to get that positive momentum going. Again, thinking about CBT and behavioral activation, right? And just sort of getting some sort of engagement, some sort of participation. And OT's really big sort of home is in task analysis and breaking down a task into the component parts and then comparing what an individual skill set is to what the components of that task are. What do they have that's going to relate to this task, and what don't they have? What can we accommodate that's related to this task? What can't we? What kind of accommodation would be the non-appropriate type of accommodation when we're talking about anxiety and OCD work? And what kind of accommodation is we're actually accommodating for the comorbid autism diagnosis that's running with this case, or the cognitive decline that's coming with this case, or we're actually accommodating to get at some of the depression that's coming with this case, but we're not accommodating some of the anxiety and OCD. But I think one thing we've definitely seen, and I'm sure a lot of you out there have seen, is just the uptick in comorbidity, and cases are getting much more complex. And the classic cut and dry anxiety and OCD cases just aren't out there as much anymore. So the more comprehensive of an assessment, the more interprofessional and interdisciplinary approach we can have, the more equipped we feel as a program to handle the acuity level of some of the challenges that are going on out there for the youth.
Yeah, could you talk a little bit about, on that note, I think that's a really good segue to what I'm sure is a question many people have, and I think you could talk more about is, can you talk a little bit about what an OT assessment does, what you're looking for in that, and how that can inform both the work you would do in the milieu, what the individual clinician would do for a treatment plan, as well as how that helps inform what might come next treatment-wise in terms of ongoing needs and supports someone will need when they transition out of an environment like residential treatment.
Yeah, so OT assessments use a top-down approach. So we're not looking at symptoms, we're not assessing symptoms, we're assessing functionality. So OT essentially has 8 different domains that we look at, particularly for adolescents. We're looking at ADLs, which is activities of daily living, IADLs, which is instrumental activities of daily living. So ADLs are self-care, hygiene, feeding, things like that, whereas IADLs are kind of most of those things to the next step. So not just can you feed yourself, but can you cook yourself a meal? So cooking is like an IADL. Medication management is an IADL, room cleanliness and sort of keeping up with your environment is an IADL. So we have ADLs, IADLs, sleep, education, social participation, play, and work is our other one. So for some of our kids, the work domain is applicable. But essentially, we just go through a questionnaire where we ask about those different domains, and we sort of help parse apart what the challenges are and how that person feels like they're doing with participation in those different areas. It's very focused on what the individual wants to be doing, and also particularly when working with adolescents, what they need to be doing, because they are at a developmental stage where a lot of what they do throughout the day is not always underneath their choice and autonomy. So it's helping them sort of balance, what actually do I need to do to get through this stage of my life? And what do I want to do during this stage of my life? And then we go through what are the barriers. And sometimes when we're going through some of those things, the barriers aren't anxiety and OCD. It's I've never learned how to do this before, or I've never been taught this before. Or actually it's a sensory thing. You know, a couple of the examples Tim and I just talked about, but it's a very top-down approach where we're looking at just different functional domains that are expected of adolescents at this developmental stage, and then sort of trying to figure out how barriers, mental health or not mental health related, are sort of impacting that. So just to get to the second part of your question too, Everett, so we would do a full assessment on that on the front side of things, set some goals in particular to the different domains of health that they want to work on. And then towards the end of the treatment plan, we would have other areas that either we didn't get a chance to address or just weren't the primary focus, but they can be recommendations for things to continue to, for kids to continue to work on once they leave. I think too, one other thing that was coming up for me when I want to hit home with the Milieu therapy is the whole, one of the big components of CBT and ERP is homework. And how that on an outpatient basis, how it's much easier for us to do in Milieu than it is to do on an outpatient basis. Do you want to talk a little about the homework piece?
Yeah, well, I think in terms of in terms of the ongoing encouragement and I don't know if accountability is necessarily the right word, but more just verifying that the work is actually done in a timely manner. And I think the homework, where it's most meaningful is when that's developed in collaboration, right? So, between clinicians and clients and staff, so I think that's really where that comes in. It brings me to the idea of the weekly themes that we do. Where each of our residents has a weekly theme, and this could be something a bit more overarching. It could be more of a, very specific, more of a SMART goal approach. And so I think that's another way to capture that, it's not just happening in the therapy session, it's happening everywhere else.
Yeah. I think I'm thinking about how we integrate the ERP and the Milieu, that homework piece, and giving kids certain things to focus on in the Milieu that then we know that they're focusing on too, right? And we can hold them accountable. I think it's been a really good sort of like feedback system that we have here. Of like every week we sit down, we establish some themes or specific goals, and then our staff are right on reminding the kids about that. We would sit down every night and ask how they went about their theme for the day, or if they accomplished their goal for the day. If not, what were the barriers? What can we do as a staff to support you guys? And it really just helps round out the treatment process, I think.
Yeah, I would agree with that. Absolutely.
Excellent. I think that takes us to about the end of our time for our discussion between the two of you. Thank you both so much for sharing so much of your perspective and your expertise. So I'd like to allow some time for any of our attendees to ask a question of either or both of you if they'd like. So if anyone out there has a question that you'd like to ask, please go ahead and put it in the chat. Tim, can you talk a little bit about ways that perhaps you see, I see a lot of complementary and parallel ways that acceptance and commitment therapy fits in with both ERP and some of the things that Zach's been talking about. Maybe you could talk a little bit about ACT and that complementary approach as well, and the ways that people can take a lot of that values work, especially on with them, into bigger parts of their life. Yeah.
So I think ACT is a treatment modality developed by Steve Hayes, and it has a different theoretical orientation, right, than your more traditional CBT. And so we're teaching and incorporating ACT concepts and education into our group therapy and into our individual therapy sessions. And if you look at it from a CBT approach, some specific techniques with a more traditional CBT, you might be teaching about thought restructuring, right? So you experience some sort of unwanted intrusive thought or just an automatic thought, and that leads to a feeling of anxiety, and it may lead you to avoid, right? These are my CBT triangle here. And so then the question is, well, can you come up with another thought that might be maybe more active or more adaptive in that situation, right? An ACT approach wouldn't really focus on thought restructuring or changing thought. It's like, well, can you have that thought, and can you keep living your life, even if it's a distressing thought or an uncomfortable thought? So it's more about, you don't have to control this or change it. You can even, using some ACT language, but you can notice that, wow, that for some reason that thought kind of hooked me, and then I was sort of off and stuck on it. But maybe I don't have to be hooked. Maybe I can defuse from it. Maybe I can get some distance from it. And that doesn't mean pushing it away. It just means noticing it's there and not having to fully engage with it or get stuck on it, right? And the values piece, which I think it's not specific only to ACT, but I think it's certainly gotten a lot more attention through ACT. It really hones in on what are a person's values, and how does that drive their willingness to do things that are going to lead them more towards their values-based life, right? So oftentimes with anxiety, OCD, other related disorders, where we're seeing more dysfunction is people get to a point and they're afraid, right? And so instead of going towards what's important and what's valued, their choice point, they're moving away from it. So they're doing so to avoid that distress and that discomfort, right? So the work that we're trying to do is actually help them notice, well, one, really sort of author their values, like really identify what is important to them, and then to be able to be aware and work with staff. When are there opportunities that you're at one of those choice points now, right? You said that social connection is really important for you, and you're also saying you're really scared right now. So here's your choice point. You can move in the direction of your values and go spend time with your friends in the milieu and in the community, or you can isolate. So how are you going to make that choice, and what are you going to choose, and what are you going to do? How can we encourage you and invite you sort of move in the direction of your values, right? So maybe you can talk a little bit too about how you're incorporating that and your team's incorporating that.
Yeah, I would say ACT, as far as like psychotherapeutic models go, is the most resonant with the OT sort of framework and practice domains. The AOTA, American Occupational Therapy Association, has actually recognized ACT as a psychotherapeutic intervention that OTs can sort of pursue, and it fits well with our professional mission and values, because it's all about acting and doing and participating, and that's at the core of occupational therapy. And it is very much so. And the core of OT has always been, do we really need to change the person, or can we change the environment, or can the person participate despite the barriers that they're experiencing? That's really what OT has always been about, and that's exactly what the foundational concepts of ACT are. So it aligns very well. When you think about people's values and belief systems, how that guides their participation. So how do you want to occupy yourself? That's what occupational therapy is all about. You want to occupy yourself in a way that allows you to live a valuable life, like that is aligned with who you are from a cultural standpoint, how you were raised, who you want to be. So values are kind of at the foundation and cornerstone of what you choose to do and why you choose to do it and how you choose to go about doing it. So ACT and OT fits really well, and then ACT and ERP seem to fit really well. And I do think a lot of our res staff working here also resonate with the ACT-based stuff and helping kids figure out their values and figure out who they are. I also think ACT is pertinent to just the adolescent population and helping kids define values. It's kind of a point in their development where they're really kind of trying to figure a lot of that stuff out. So
I would agree with that. And I think also in some of the family work that we're doing as well, we're also incorporating not just what are the residents' individual values, but what's also a family's values, right? And then how does that help shift some change. And we're using more like a space model approach, a supportive parenting for anxious childhood emotions approach to our family work. And so how does a family's awareness of their own values then help to reduce unhelpful accommodations, things that are inadvertently keeping the anxiety going, right? So I think that idea of ACT and values work, I mean, there's a lot to ACT, but I think the values work definitely resonates with what we're doing here.
Zach, question about OT on an outpatient basis. Are there ways that people who are receiving more traditional mental health therapy can find ways that they can incorporate occupational therapy into a young person's treatment on an outpatient basis as well?
Yeah, so our profession at large, and maybe I can talk about this when I get to one of the webinar series now, and we can talk about OT and mental health a little bit more in depth and sort of where we fit into the healthcare paradigm. But I think there is value to answer the question. Yes, there is value in us being on an outpatient basis. I hesitate to say like a really resounding yes, because it's hard to find an outpatient occupational therapist who's picking up like independent contract work, particularly for mental or behavioral health. I think the real move would be to start to get OTs involved with primary care clinics and things like that, so there can be referrals and collaboration. I do think that there's room for OTs to get into more outpatient mental health and behavioral health care institutions as a consult, or to be able to provide that sort of in the moment training. But we really hone in on the functional application of the therapeutic skills and principles in real time, in action, when you're doing an actual activity. So I think as far as bridging that gap between the therapy room and real life, OT definitely has a role in helping sync those two things. I mean, that's really what our role is here, but in the community, even more so.
You know, I would say too, to my previous experience of working with OT has been more in the realm of schools. And so, you know, as someone who has done outpatient therapy and then also work within the schools, I think that's where it can be helpful to make time for that interdisciplinary, you know, transfer of knowledge and conversation about what are you seeing with your client and how can you both work together to be helpful. So. Yeah,
that's a really good point. I think that's a really good touch point for a lot of folks. Like if you are working with a young person right now, like see what's on their IEP plan, see if there's an occupational therapist on their IEP plan, and they may be on the IEP plan for other things that aren't related to mental health, but I guarantee you that if you had communication directly with that OT and communicated about what you were hoping for them to be transferring from the outpatient therapy room into school practice, they could help figure out ways to bridge that gap. I think that's a really good starting point for people.
Does anyone else have any other questions for Zach and Tim? Give it a few seconds if anybody's feeling shy. We did also, Zach and Tim got a lot of people commenting that thank you and that they found this really informative. So
taking the time.
Yeah, appreciate it.
Yeah, we're happy to be here.
Yeah. So I want to thank everyone for coming today and sharing your lunch hour, or depending on your time zone, your late afternoon, or maybe even a little after with us. Hopefully you found this informative. We'll have more of these on different topics coming up, and we'll be sending out information about that in the near future. So stay tuned. We will also have this recorded and available. So if you feel like anyone might want to hear this or learn a little bit more about our approach, and certainly get in touch with us. We're always happy to speak with anyone and answer any questions, but we'll make the recording available and you can pass that along to others as well. So again, thank you all for joining us today, and have a wonderful afternoon.
Thanks, everybody. See you later.
Thank you.